is 10 feet or 3 times our height. So how high is 20 feet?
Yep.
2 stories.
Twice 10.
So if you jumped out this window, does that meet criteria? Yeah? If you jumped off the railing out there, does that meet criteria?
Yeah.
Yeah.
You guys might want to remember that when we start doing scenarios, just saying.
We're doing parkour.
There's a good spot out there. There's a good jump spot out there, I'm just saying.
You gonna make us jump?
Okay, so we got falls. Okay,
Is it?
death or ejection? Okay, so death in the same car.
Including a pet.
I thought it was a squirrel.
I had a car accident where the dog was full on impact, the driver was fine.
I had a call where dog died on impact. The patient refused to go, didn't want to go for a long time, and then came back. And then the ambulance got there, and then they're like, okay, I'll go, and then no, I don't want to go. So then the ambulance leaves, and then a little bit later, it's like, oh, okay, maybe I should go. I'm just like, okay, are we going or are we not going? I was like, we need to make a determination. So we had 3 different ambulances come for this person with a dog had died, so then we're like, oh, okay, that is a pretty good impact to kill something that was living inside. And so they actually called and asked. And they're like, the fact that they have come and gone a couple times, no, we'll just kind of evaluate them. But that is something that you're definitely gonna make the phone call to be like, hey, there's some mechanism here, so talk to your doc about it, okay? So death in the same car, can somebody be totally fine with nothing wrong, but somebody else dead and sitting next to them?
Yep.
Right, so a lot of it depends on the mechanism, where the impact happened. If they're totally fine, and there's absolutely nothing wrong with them, what do? You activate?
Call the doctor.
Call the doc and paint a picture.
Paint the picture, right? So, with this case, when there's the death of a human, so there's probably gonna be some sort of significant impact where the car is gonna be totally mangled, and it's gonna be one of those times where it's just like, there's enough here, I have the mechanism, I have the intrusion, I have a death, it's like, you know what, I'm not even gonna take the time to call the doctor. Oh, there it goes. And I'm gonna go ahead and do a trauma activation on this one. Ejection, when do they have to be ejected?
Out of the
Out
car?
of the vehicle.
Nope.
Or even partially?
Yep, so they can have partial ejection, so you can have your torso out, your legs still in it, flip over, roll over, they're hanging out of the car when they get there. That counts as a ejection. Okay? Telemetry. Allie, does your car from
What
the
if one
70s have
person's-
telemetry?
1966 Mustang?
96 Mustang, does it have telemetry?
What's
I don't know. What's telemetry? You got a layman's term of telemetry.
Telemetry is the computerized system built
Oh,
into
God,
cars
no.
now, like
No, 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 no.
OnStar, stuff like that, so it will record the impact that happens.
Yep.
And then a lot of times it will send, like, oh, we recognize that there's been a significant impact, are you okay? You know, you see the commercial and they're like, oh, I was in an accident. Don't worry, 911 is on the way. So that is telemetry. So the funny thing is we joke about this, but we've started getting these calls where we get the 911 call, we're on the way there, and then all of a sudden they'll put into our details that says, car telemetry information states high impact. And we're like, huh.
Sweet.
I'm like, hey, high impact. Somebody just jumped. I knew it. Shouldn't have said it too loud.
My car doesn't have that.
But most of your
We
cars have
splurged
it.
on a cassette player.
Heard it. Okay? So,
For the ejection, does that mean, would that include a passenger ejected but not the driver?
yeah,
Anybody-
so any
anyone
sort of
ejected?
ejection, you're gonna activate, because it's just gonna be a significant mechanism associated with the accident. If there was enough force to toss somebody out, then there was enough force inside the vehicle, that you're just going to, activate. Okay. All right, so any questions on any of that stuff?
Yeah, the one you were saying, you get these calls?
On what?
You get the calls from the, like OnStar or whatever, about high impact?
Yeah, Yeah, so so we don't get the call, so it goes through dispatch, they contact dispatch because they have their GPS location, so they contact the local 911 center. And then, so it's usually a little bit of a delay if they're not the initial caller. And so there's a little bit of a delay, so like as we're going to the call, all of a sudden a new detail will pop up that says, per car, I think it says per car manufacturer, high energy transfer or something per computer telemetry. That's what I call it. I mean, we always joked about that. We're like, oh yeah, we're gonna push the OnStar and be like, excuse me, was there a high energy transfer in this accident? And so, but the crazy thing is so the ones that we have gotten, they were legit. Like we're like, okay, we're gonna get there and it's gonna be like a front bumper thing. And we get there and the front half of the car is gone. We're like,
Yep.
okay, like, so we were trying to figure out, never did, I said we were gonna look it up and try to figure out how they dictate what's significant, what's not, but we never got around to following up on it. So. Okay, so all of these things are mandatory. If we have any one of these things based on the criteria, it's a mandatory trauma system activation. All right, so as we start doing our trauma assessment stuff, when you guys go to move your patient from the gurney, or from the ground to the backboard to the gurney and say, hey, this is a trauma activation criteria, we're gonna want what criteria you're using now, okay? So this is the mandatory stuff. All right, Ash, you guys used up all the
Can I
whiteboard?
take a picture before you erase it?
Yeah, I was gonna say, because I need more room.
Allie?
If you really want to, you can erase the drug thing too.
No, I actually really like that.
But she has to redo it still.
Oh, you do? Why do you have to redo
I
it?
don't, he
'Cause
says
you
I
said
have to
half of
redo it,
it
I just
wrong.
technically have to add more to it. You don't have to redo it.
No, I really like that, so I don't want to erase that. I wouldn't mind erasing the challenge thing. Just kidding. Do you guys have all this information? Or does this need to stay, you think?
He can always rewrite that.
I can remember that.
Yeah.
Everybody else remember that, yeah? That's probably all I need.
$100, they're helping,
Hmm?
man. $100, they're helping.
Maybe we just hold out even longer. Next term will be 150. Then 300.
Hey Noah, why'd you use smart peppers when you have peppers?
Because yours were there.
What is that?
Wow.
You're not gonna need, you're not gonna need
That's not what Narky
food,
is.
Dad?
That's not what
That's not
Narky
what-
is.
That's not what it is.
Good try though.
Alright, so section 4 is our special considerations.
Comorbidity. Comorbidity.
Old people,
Elderly.
young people. Funny thing is so what do they consider old,
55.
right? I feel like I'm way too close to that, so yeah, we're gonna say,
Oh,
Seasoned.
sure.
Wise.
Okay. Sophisticated? There you go.
sophisticated.
Yeah, so, over 55, so why is that something that we're gonna consider activating on?
You don't compensate as well?
Okay, you don't compensate as well,
bones get more fragile.
osteoporosis sets in.
Depending
What
on
do you say,
how.
Alan? Comorbidities. I don't
Oh,
even
this
know
is-
what comorbidities are.
This is
So they
cool.
have,
You're gonna use
other,
big words for the whole class, might as well use them for everybody, huh?
Yeah, teacher. Mr. H. Mr. H.
Carry on.
Depending on how old they are, they can really. You're going to?
you go.
But I kinda wanna.
Explain though, explain your word, because I don't know what that is either.
Um,
What was the word?
it's, comorbidities, other medical conditions that they have that would increase their mortality.
Oh, so like,
So they have a heart problem, like an underlying heart condition, and then they also get in a car accident.
What was the word again?
Comorbidity.
Okay, I'm not
so you
gonna.
mean things that they would be on blood thinners for,
Right.
potentially, right? They have underlying heart conditions, and maybe their ejection fraction is already at 10%, and now they're going into hypovolemic shock, and so now they're unable to keep up because their heart doesn't have the ability to pump that, right? I mean, that can happen at any age, but the older you get, the more likely you are to have some of those conditions, okay? All right, got blood thinners, anti-coags. So what's one other than Coumadin?
Plavix.
What'd you say?
Warfarin.
I said other than Coumadin.
Yeah. Xarelto.
Aspirin. So all that sophistication of comorbidity just went out the window, just so you know. Okay.
I still get it.
So you got Plavix, you got Xarelto, you got Eliquis, what's the other one? Pradaxa. So you have multitude of ones, right? And people are actually going away from, they're going away from Coumadin now, okay? So just so you know, they're going away. So you're gonna have to start memorizing a lot of these newer ones, all right? All right, so we got blood thinners, anti-coags. All right, what else?
Pregnancy.
Pregnancy, why is that important?
Because there's 2 of them.
Yeah.
And your physiology of your body's changed.
Yeah.
Physiology behind your body changing?
I said your physiology is different, like more
Why-
blood.
Why'd you get uncomfortable when I just asked that? Like, you're like, oh, jeez.
Oh, I just thought I said it wrong.
No, yes, so the body goes through a change, it has a increase or decrease in blood supply, right?
Increase.
What's it do?
Increase.
Increase, so what can potentially happen?
You need that increase, so if it bleeds out, then you're in trouble. Faster,
So
faster.
you said there's 2 instead of 1, right? Was that, you know that said that? Right. So what happens if mom
Or 3.
dies?
Baby dies.
What happens if baby dies?
Mom's
Mom might
maybe
be
not
risk.
dead.
The mom is very close, right?
Could be.
Potentially, yes. So you have to work, so you keep mom alive to keep baby alive, right? So you have 2 patients that you have to monitor, so your hands are full even more now, you're having to think more, you're having a whole lot more on your plate. And then you have the compensation of how are they compensating with this increased blood supply? Does their blood pressure normally go up or go down?
Up.
Okay, so now you have a high blood pressure, so what happens if they are at 80/40?
Oh, that's horrible.
Even worse than somebody else.
So we're already not happy with a normal person, right? So if we're at 80/40 with somebody that's pregnant, oh, my stomach is starting to hurt, right? I'm getting uncomfortable. I'm already uncomfortable because I automatically start going to this, okay, we got 2. I'm like, all right, I got 1 job here. 1 job is to keep mom alive. Oh, geez. So, crazy thing, so one of the first partners that I ever worked with, long gone, right? You used to work up in Portland. He used to tell me this story. He goes, I just need to know, like on my 4th day of paramedic internship stuff, he goes, I just need to know. I'm like, no what, sir? I'm like, and I'd already heard stories about this guy. He goes, are you willing to take a scalpel and do a C-section in the middle of I-5? I'm like, nope. Do you want me to quit now or later? I'm like, I can stay the whole shift if you want, or I can just go home now. He's like, I just want to know if you're capable of doing that. I'm like, I would have to do some research, I think, and review some stuff.
YouTube video.
Yeah, because the thing is, we didn't have YouTube
You
back
can hold
then.
this up while I
Wait,
do
was
the
that allowed at
scalpel.
one point?
So
It's allowed.
So they had a call. I don't know. I don't remember the whole details about it. Long story short, it was a mom that was 9 months pregnant. Mom was deceased. Okay, they could still see the baby moving, and it was a semi versus car. I don't know where they were. This was back before the life flight days and stuff. I don't remember all the details. All I remember him saying was, they called the hospital. The hospital says you have to do a C-section. And he's like, I have to do what? Like he made them repeat it like 3 to 4 times. And so him and his partner were both sitting there like, we don't even know what to do. Like this was before FaceTime. This was before you could be like, hey, this is what we need to see. Like
Is this
show
before
us.
paramedics had to take anatomy?
This was before paramedics had, yeah, way before that. This was back when it was 1, 2, 3, 4 still. It might even have been before it was even 1, 2, 3, 4. Like this dude was old and salty, like old. And he's just like, yeah, he goes, and then we fumbled our way through, using other terminology, fumbled our way through this, but the mom was dead, so we're like, well, okay. Crazy thing is, so like he says it was like, cleaning a fish, as they were doing, they're like, that's what we kept referencing, like, okay, we're getting through this layer, okay, we're kinda getting through this layer. And they were walking it through the phone, they're like, okay, so you should be through this layer of skin, and he's like, I think I'm 2 layers past that already. They're like, okay, and so this was just mass chaos stuff, and so crazy thing was, so the dude saved the baby, right? And I'm just like, so he's like, so at the end of the story he goes, so I need to know, are you able to do a C-section today? I'm like, sir, we don't have an I-5 on our response area, so no. And he's just like, he starts laughing, he goes, I can see we're gonna get along good. I'm just like, but I'd appreciate it if you teach me how to do a C-section, use that thing. So yeah, so crazy. So anytime I have an MBA with a significantly 9 months, I'm just like, oh Lordy, thank God I'm not.
On I-5.
Thank God I'm not on I-5 and that there's a hospital within 5 minutes. So yeah, so I didn't know, because I had so many questions, but I wasn't gonna ask him because he's salty. But I was like, so why didn't you just go and just CPR on the mom and keep mom oxygenated and stuff like that? I'm like, so I don't know if she was entrapped part way or I didn't get the whole details of it. And then he retired out and he was gone. And it's one of the things that I've always kicked myself about not getting the full details, because I was just because I just blew my mind on day 3 of writing. I'm just like, are you ready? I'm just like, not even close. Yeah.
So going off of that, what is this, I guess the upkeep or training requirements for, say, a paramedic that got their license 40 years ago and never did any anatomy and stuff like that? How does that compare to a paramedic who is just recently licensed?
Well, I don't know. I got my paramedic 20 years ago, and you're just getting your paramedic.
Okay.
So who do you think would have more knowledge?
Well, you obviously, but so I'm confused about where does that information do you take extracurricular
No, it's all the same.
classes?
It's just continuing ed.
Going to a
Okay.
continuing education
Yeah.
requirement right now.
Yeah. Just curious. Hear that? So everybody does continuing ed already, right? So reading basic, so all your research stuff is all continuing ed. So there's no specialized C-section training that you're gonna go through. Every year you have 5 skills that you have to be evaluated. Your doctor has to check you off. Can you do a needle cric? Can you do a surgical cric? Can you do needle decompression? Can you work a code? Can you do a trauma assessment? Do those, and then they're like,
Yeah.
all right, good. You haven't done anything in the last year or last 2 years to screw anything up. We haven't seen your name come across our table at the state. We're gonna say you're still doing a good job as a paramedic. Okay. All right, so get back on topic here. All right, so we got pregnancy, we got that, we got our children, low impact. Here we go. Low impact stuff.
Wait, for young people, is that just pre-puberty?
Pre-puberty. That's a very good way. So what's puberty? What age is puberty usually?
13.
Just presence of
10 to
second of
Usually 12
hair
is
in
the
the
age
armpits
OEU
and breast
says.
development?
What's that?
Hair in the armpits and breast development almost?
Right, but what age do we tend to shoot that for?
Around 12.
Around 12. Around 12 is kind of what we've gone kind of with the cutoff-ish. Anything over 12, they're adults, and so anything under that, then you have to work on that portion. Okay. Low impact. So what kind of low impact injuries?
Fender bender?
Fender benders, yes. Yep, so minor MBAs. What else?
Heavy blunt objects, significantly heavy objects that hit people at low speed.
Like
Crushing.
pallet of plywood that somebody takes a forklift and bumps into you and smushes you.
55-gallon drum falling off and hitting you.
Would that be up with crushing?
We would start working over here on some of these other things. So think less. So think hey, I tripped and fell and I hit my head. Okay, so fall injuries are one of the big ones that commonly get mistaken and don't get So you have somebody go on intoxicated, they're bleeding from their head, right? They got a lack. What do? We're like, oh, this person's drunk, just tripped and fell, right? What could this person have? They could have a major head bleed going on, right? So you have to have this high index of suspicion with even minor incidents with people, all right? So you have to do your full assessment. Don't just let them be like, hey, oh yeah, throw them on the gurney, take them to the hospital because they're intoxicated. You have to do a full assessment and be able to check everything, stick your fingers on their skull and not all the way through, right?
Preferably.
Preferably. All right, we got some burns, right? Yes?
Yep.
Yes.
How much burns?
Hands, genitals, feet,
Is it the percentage, right?
and then
Oh, yeah.
percentages.
Special areas.
Special
right?
areas.
Special areas and significant.
Is it
Okay.
any facial burn there?
So facial burn would be a
Special
Special
area.
area. Genitals.
So
special
hands, feet, face, genital areas are all special areas, and then any significant amount of burns, okay? So with here locally, we're not something that where we have a burn center close, right? But if you have a trauma patient, say you guys go to Portland, they have Emmanuel Burn Center up there, right? So you go and you're working in Portland, and you have a patient that was involved in an MBA, high-speed, multi-collision, person unconscious, unresponsive, and they're burned 50% of their body. Do you go to A, OHSU, which is the top level 1 trauma facility, or do you go to B, the lower trauma facility, level 2, but it's got a burn center there?
What are their other injuries?
They're all kinds of jacked up. You name it. So give me a hint.
It's harder to take care of a burn patient than it is a trauma patient.
Yes. So the burns, you want to go where they specialize the burns. Okay?
That's
So
not at OHSU in Portland, it's at the other
It's
hospital.
Emmanuel.
That's what he
Yeah.
said.
Emmanuel's a level 1 though as well, so,
Yeah.
but that's not the example you
yeah.
gave.
So I was trying
It's not the example you gave.
Yes, I was trying to make it so that you had to make a determination. Do you take them to the burn facility, or do you take them to the trauma facility, right? So you take them to the burn facility because burns are much harder, because they're gonna end up at the burn facility anyway, right? So basically, all they do is they take them to the level 1, they stabilize them, and then they move them over to the other one, right? They can stabilize them here as well, okay? So you got your burns, what else? Mm-mm.
Toxic hidden inhalations.
No.
EMS provider judgment.
Oh, man, mother load of mother loads. I'm just gonna call it the cheat. So that's one thing I will not allow you guys to use as your criteria
I think it is.
when you guys do your thing, when you guys do your trauma assessments, okay? So, at any point, you feel like the patient needs to go into the trauma system, and they don't meet mandatory criteria, they meet something minor like the fractured femur, right? You got a fractured femur and that's it, but it's an open femur. Are they going into surgery? Yes, right? Do they have some mechanism that didn't meet any of the criteria? Yes, let's say a horse kicked them, right? And you got splurting blood, so you got femoral artery laceration, right? Do they need a trauma facility? Yeah, because there's a potential for pelvic fractures as well. It's a little bit more than an orthopedic surgeon.
You just met your criteria right there.
What did I?
Potential pelvic fracture and a femur fracture.
Okay, let's take the pelvic fracture away.
Sing along, Bob.
So you have stability in the
Yeah,
pelvis,
perfect.
but you have the potential for it. So we didn't meet that criteria, okay? So what I'm saying is like you can activate,
I don't know, horse kick could go pretty fast.
The mechanism.
it's not 20 miles an hour. Once you're standing there, changing shoes, whack, right?
Yeah.
Don't get the
Fast. Anyways, so, just a sec. So what I'm saying is you can activate trauma system based on 0 criteria whatsoever. If you feel like they are going to need a trauma surgeon, they're going to die soon for some crazy reason, trauma related, that they haven't met criteria yet, things just aren't looking good, you can absolutely go with paramedic discretion. Okay, you use that, that's the throw down card, and most of the time that's what people will use when they're trying to remember some of the criteria that, it's like, oh dude, this guy got shot here, here, and here. It's like, oh, well, he got shot 3 times here. It's like, oh, well, that doesn't meet any activation criteria. But, who knows where the rest of the bullet wounds and holes and stuff go, right? So they're like, we're just gonna use paramedic discretion on this, until we can figure out exactly what's going on. Yes?
So for all of these criteria, you have to have the initial cause for you being called is because of a trauma.
No. You have to have a initial cause, not necessarily because you're being called, but you have physical findings that tell you there's trauma related to it. Okay? So if you just find somebody down with no physical outward injury whatsoever, they're just laying down in their, so say you take a 38-year-old female that's pregnant and is just down, you're not necessarily gonna do a trauma activation because you don't know why you're there. Now, if you come up and you find that she's got a big old depressed skull, or you got something, she's bleeding somewhere other than where she should be, then you would do a trauma activation on it.
Okay.
Okay, so kind of take that whole thing of why you're there in the call and eliminate all that dispatch information. Go with the information that you obtain based on your physical findings, what you look and what you find, and be like, I think this person had a trauma-related incident, and so therefore, I'm gonna take this criteria and use this as a trauma activation criteria. All right, so I got a pregnant female that had fallen, was down, I found bleeding from the head, we're gonna do a trauma activation criteria on it, okay? So with these ones over here, these are things that are not necessarily mandatory criteria, okay? Those are things that if you just start putting a couple of these things together, it's raising your high index of suspicion, and you can say, hey, we meet some of these special considerations. You know what? We might be in that trauma activation position at this point, right? We're like, okay, so some of our blood pressure is starting to drop in the elderly. We know they're not able to compensate as well. We're gonna activate based on this ground level fall. Okay, does that make sense?
Yeah. Also for burns, so if they're burned in a special area like their hand, what percent of their hand will
So think of it like your whole hand, burn your whole hand, stick your whole hand into a pot of water, pull it out, so you got like 1%, so that's like a 2% worth of significant burn,
Right.
but because it's special area, it's considered, and it's not mandatory, remember, it's only like that discretionary, you can make that determination if you want to or not. Yeah.
So like the ripping of an aortic aneurysm, is that a trauma activation?
Depending on the cost.
So medical.
So think about it, okay? I like where you're thinking, okay, so you have a ripped aortic aneurysm. A, are they gonna be alive or dead?
Dead.
Dead.
Pretty close to dead, right, if it's ripped, right? So what is their blood pressure gonna be?
Not lower than
So it's
90.
gonna be below 90, right? So we meet mandatory criteria based on that. You don't know that it's ripped because you don't have x-ray vision, right? So you have no idea if they have a ripped aortic aneurysm. But you're meeting that criteria based on that, and you have some sort of trauma-related event. So a lot of times you're gonna get that shear in accidents, you'll get a shear of the aorta, and they're dead before you even make it there, right? But if they're still alive, you're gonna have something less than 90. And then,
If it's a medical event and you're suspecting that it's really close to ripping or just has a small hole, would that be kind of paramedic discretion? Because they're gonna need a trauma surgeon,
and the
right?
person came from a trauma?
Not trauma
So
related.
remember, so if it's not trauma, you're not trauma activation stuff, right? It has to be trauma related to get you into the trauma
But
system.
they need a
They don't
trauma
need a trauma
surgeon.
they don't need a trauma surgeon, they need a cardiothoracic surgeon is what they need. Trauma surgeon is the one that can basically fix anything from here to here, top to bottom, like they can fix anything quickly, stabilize, and get them to the specialized surgeons, okay?
In those cases, whatever they're hearing over the radio report, they'll start making those calls to departments if they need somebody to come. It's not trauma activation, but they'll be like, we need a cardiac surgeon down here now, or we're gonna wheel them up as soon as they get here.
Okay, does that make a little sense? Yeah? All right, so remember, these are not mandatory, but these are. to meet this criteria, you have to go into the trauma system, okay? So when we enter somebody in the trauma system, we call them on the radio, let them know that way, and we also put a band on them, a green band, that is coded and it has a number on it. That number will stay with them throughout their entire hospital stay, until they leave the hospital. That is how they track all of the statistics on that patient into the trauma system. So it's very, very important to put that trauma ID band on them when you put them in the hospital. So what do we do if we don't put the trauma band on? What happens?
We get in trouble.
No, we don't get in trouble. But now the hospital puts their green band on, and now you have to track down that number to find out how to document it on your thing so that your paperwork goes with their paperwork. Okay? So it's not the end of the world, but they do give you a hard time and be like, oh, hey, what's the trauma ID band number? And you're just like, God, I knew it. I forgot something, because that's really high on your priority, right? As you're managing the airway and RSI in somebody.
Absolutely.
And trying to keep them alive.
Stop
It's
everything.
like trying to get that, trying to get that ID band. So usually that's like the last thing as you're rolling out of the back of the rig. They're like, wait, hold on. And then we'll throw on the bracelet. We're like, okay, whew, that was a close one, right? And then it's like, okay, write that number down really quick. And then somebody writes it down on their glove, and I'm like, oh, you put it in your glove. Kidding me? Okay, so any questions on this? No? You guys are crystal clear on trauma activations. Cool. All right, modified versus not. Locally, we do not do modified trauma activations. Okay? If we activate the trauma system, it's all or nothing for us. Okay? The hospital, on the other hand, they will go modified versus full. So what's the big difference between the two?
Amount of resources.
Like trauma surgeon and couple surgeon.
Right, so when you have a modified, basically what they're gonna do is they're gonna bring in x-ray, they're gonna bring in RT, they're gonna bring in a couple extra nurses, a scribe, the ER doc's there, usually maybe a second ER doc, and that's what you get on a modified. If you do a full trauma activation, they are required to call the trauma surgeon, an anesthesiologist on top of everything else that they called as well. Okay, so the big thing is you get anesthesia and the trauma surgeon there when you call for the full. Now, if we call full, we use the criteria that we use. A lot of times what happens is the trauma surgeon will walk in, he'll stand at the foot of the bed. I don't know if have you guys done your Sacred Heart stuff? It's comical. He comes in, stands at the foot of the bed, he looks at it for a little bit, doesn't really do a whole lot, and then he's just like, yeah, call me if you need me, and he leaves. And it's like, because based on what he sees, there's not, like, he met criteria, like, oh yeah, so you got a femur fracture and a humerus fracture, it met the criteria, so it went into the trauma system, but is that something that the trauma surgeon is gonna fix? No. Now, if this person is actively, like, unconscious, dying with chest wall instability, he may crack the chest right there and be like, okay, let's go to work, and go right in and start doing stuff. So what it does is it gets both of those there, ready to go for it. So they both show up. Anesthesia is always in-house. Trauma surgeon's not always there. So I think, I want to say they have a 5 or 10 minute response requirement. But yeah, so that's the big difference that you'll get. So if you know somebody's gonna be having surgery, a lot of times when I call it in, I'll be like, yeah, we have open fractures and multiple orthopedic fractures. They're gonna call orthopedic surgeon in as well to get that ball kind of started. All right. Questions? Piece of cake? Yeah?
We can't have cake.
Can't have cake, no cake. I mean, it's low sugar, it's only 3 grams per full cake of Twinkies.
What?
All right, go ahead and take a break.
Get like a kilogram.